Welcome to The Buzz, where we bring you leaders in dental education discussing hot topic courses and industry trends. I'm your host, Vanessa Emerson, founder of Dental Speakers Bureau, and I'm super excited today to bring to you Dr. Kimberly Harms. Kim, thank you for being here.
Thank you, Vanessa.
I've asked Kim to share with us a little information about her course that's entitled When the Pain is in the Brain: How to Encourage Patients and Staff Struggling with Emotional Illness, Stress, and Grief. Now, Kim herself has personally experienced catastrophic loss, including the suicide death of her mother and son, nerve damage, ending her clinical career, and multiple serious health issues affecting her husband, Jim. Kim, this does sound like it's a very profound, very important topic. Can you help our meeting planners that are listening in understand and connect this to the dental team? What's happening for the dental team that why would they benefit from this course?
Well, Vanessa, I am a grandma dentist with a past, and I'd like to use that past and my experiences in private practice, public health, to help other dental professionals navigate their way through catastrophic loss. Quite frequently, that happens that we have to face it in a dental office, not just when it happens, the typical time that it happens, but every patient for 6 months, for a year. It comes back time and time again. We need to have a place where we can go that'll be safe for us in that dental office, because we have to put on a show when that dental patient arrives.
Absolutely. So could you tell us more about what is taught in this course? How do you solve that challenge for them with this course?
Well, first of all, we outline emotional issues that might occur even in our patients that affect their dental care. And we also talk about how we can deal with emotional loss ourselves. We talk about the 4 tasks of mourning, the difference between grief and mourning, and how we can go into the dental office and work our grief out in a dental office situation, how we can develop safe rooms where we can go when we need to, how we can have the entire team come together and help us get through our day. Because once again, it's a very difficult day to get through when you're facing that grief time and time again with each new patient that arrives, and you still have to put on that happy face. Very difficult time, and I try to give you the skills to be able to do that as well as possible.
You know, I'm just thinking how, we're human. And things happen. And I think a course like this is so important because we've all dealt with different varying levels of catastrophic or more mundane, stress and that sort of thing. Could you share with us just a couple of maybe the tools or resources? What type of things will we learn specifically?
Well, we'll learn to, as a team, help understand patients that come into our offices. First of all, many of them have fear and anxiety. You take a look at what we do in the dental office. We look at them with our little googly-eyed glasses, and we have light shining in their eyes, and we're drilling human tissue. I mean, we do unbelievable things, and patients will allow us to do that because their oral health is important. But we have to really understand that patient. Sometimes we take that for granted. And if there's an underlying emotional illness or an underlying fear, I give you the tools to help that patient come into the dental office and receive that treatment and leave the office feeling good about the care that patient is getting. I also give you skills about how to manage staff members, team members that are undergoing stress and grief, divorce, death, just stress in their life, money problems. We're human beings and we face that and we're dealing with it, but we need to come into that dental office and put on a happy face, because those nervous patients are nervous enough already. They don't want to come in to a gloomy office. So it's a very, very difficult balance. I've done it. I've had to do it myself, so I'm not going to talk about anything I haven't had to do myself, but I would just like to help other people do it. I've been there, and I really want to help other people get through that time. And it can be gotten through, and I just have to say right now I'm speaking from a place of joy and happiness as I move ahead in life, and you can do that too. And I'd like to get that message of hope as well for people who go through very difficult times.
Yeah, wonderful. Well, it sounds to me like there are multiple other terms we could use for this topic, like it would fall within the realm of team building or communication or emotional intelligence, or like there's so many aspects of what you're talking about that roll into some of these other very important elements of solidifying our team and also providing exceptional patient care. It sounds like it's for a course that's for the team typically.
It's for the entire team, and it absolutely goes towards team building, because when you're a team, you have to work with the difficulties and the members that are there, and everybody, grief and problems are inevitable, conflict is inevitable. And so for anybody that has a team or ever has a patient complaint, I think this course would be very, very helpful.
Awesome. And one other question, is it normally a half day, or like what's the best format for this?
Typically, it's a half day. It can also be expanded into a whole day, in which I'll delve more into mental illness, including depression, which is rampant in our society. There's such a stigma to depression. I have it myself. I'm treated. So I've been a dentist with depression, and I know I've been there. Been there, done that. I would love to help other people who are struggling with this, remove the stigma of this disease, and get people treated.
Awesome. Well, it sounds like a really interesting and very important topic, and I appreciate you sharing, especially from your own personal experience. I think that is really poignant, and certainly will inspire and touch the teams that hear your topic. Now, is there anything that we haven't touched on that would be important for the event planner to know before we go?
Well, I can customize this program and focus on any part of the mental illness, emotional illness, grief, or transition. Many times transitions also can cause some emotional issues that need to be dealt with. So I can customize this to meet the needs of any event planner.
Oh, excellent. Well, there you have it. For more information on bringing Dr. Kim Harms to speak for your next meeting, visit dentalspeakersbureau.com, where you'll find Kim. You'll just need to look her up under Find a Speaker by her last name, Harms, or there is a search function where you can put in Harms and it'll pull you right to her listing. If you would like help reaching out to her, you can certainly email us, info@dentalspeakersbureau.com. We'd be happy to connect you. Thanks again, Kim, for sharing with us. I really applaud what you're doing here. This is fabulous. And thank you all for tuning in. And until next time, be well.